Hello, my name is Dr. Joanna Sikkema, and I am an adult nurse practitioner and a former member of the FPCNA Board of Directors. Welcome to the FPCNA Timely Topic Podcast, Preventing and Treating Venous Thromboembolism, the Role of Novel Anticoagulants. VTE includes deep vein thrombosis, known as DVT, which are clots in the deep veins of the body, and pulmonary embolism, known as PE, which occurs when a clot breaks free and enters the arteries of the lungs. This is a life-threatening condition. The good news is VTE can be prevented, and the first step is knowing who is at risk. Risk factors for VTE are advanced age, immobility, surgery, and cancer. Preventive treatments may include mechanical compression devices, early mobilization, and anticoagulant medications. Until recently, the only choice for anticoagulant for perioperative VTE prophylaxis was unfractionated or low molecular weight heparin or warfarin. However, several of the novel anticoagulants now have indications for prophylactic use. The anticoagulants dabigatran, rivaroxaban, and apixaban are typically started within hours postoperatively and are continued for at least 35 days after major orthopedic surgery, such as a hip replacement, and 10 to 14 days following other orthopedic surgeries, such as a total knee replacement. Novel anticoagulants are also used to treat and prevent VTE reoccurrence. The 2016 evidence-based guidelines for the assessment and treatment of VTE from the American College of Chest Physicians provides a series of recommendations regarding choice and duration of anticoagulant therapy. Most patients with a history of DVT or PE require at least 3 months of anticoagulation with either warfarin or a novel oral anticoagulant such as dabigatran, rivaroxaban, apixaban, or indoxaban. High-risk patients may require a lifetime use of anticoagulants. All anticoagulants carry the risk of bleeding. It is therefore very important to include patients and/or their caregivers in decision-making regarding the choice and duration of anticoagulation therapy. When prescribing oral anticoagulants, it is very important to educate patients about the increased risk of bleeding and advise them to avoid the use of NSAIDs or other medications or supplements that can increase their bleeding risk. It is also critical for patients to know which medications they are taking and the availability of a reversal agent in the case of an emergency. There are some general best practices that can be applied in working with individuals with VTE, their families, and their caregivers. As with other healthcare topics, providing clear, understandable information is critical to the process, and using basic living room type language that is conversational rather than a lot of medical terminology will help patients at all literacy levels better understand what is being discussed about their medications.
Hi, my name is Kathy Berra. I'm a nurse practitioner and a cardiovascular nurse specialist. I've worked for many years in CVD risk reduction, and I am here to tell you about a beautiful new brochure that's recently been published by the Preventive Cardiovascular Nurses Association. The subject of this brochure is VTE, or venous thromboembolism, as we all know. Every day in our lives, whether we're working in cardiac rehab, we're in a clinical setting, we're in the hospital, we run across people and take care of people who are at risk for having a VTE. Some of the risk factors, as you know, are major surgeries, fractured bones, major injuries, a recent diagnosis of cancer, physical inactivity, in particular prolonged sitting, people who travel a lot and sit in airplanes for hours at a time, pregnancy, and certain medications can put us at higher risk for VTE. This pamphlet has a ton of information that is so useful clinically that you can give to your patients, and talks about if someone's at risk, there's a whole half page on how to possibly prevent ever getting a VTE. There's warning signs so that you know to go and be evaluated as a patient if you have those warning signs. And it explains some of the tests like Dopplers and other types of tests, blood tests like the D-dimer, that you can have done to really rule out or rule in a VTE. It's a fantastic brochure. I really recommend that you all go to pcna.net, to the patient education portal, and order these. You can get as many as you want, and you can then also hear a lot more about the Preventive Cardiovascular Nurses Association. Thank you.